Hi everyone, I'm Dr. Joseph Cipriano, and today we have my pregnant wife here with us. Now you are 10 weeks this week, correct?
Correct, yep.
Alrighty. So let's give a little update, kind of just tell everyone what's been going on. I know earlier today when we were walking, why don't you tell everyone what was going on?
I've been feeling great, not nauseous at all. This pregnancy is a lot easier than my last. However, today I did experience for the first time during this pregnancy sciatic pain. So I'm going to have you check that today.
Okay. And now you felt it down which side?
On this side right here.
Okay. And the pain went from where? Can I point to where it was
Yeah,
at?
of course. It started out from basically the bottom of my back, and
Okay.
it went down just a little bit to about here.
Okay.
It just kept feeling like it's spazzing out, so I had to, slow down my walking.
Okay.
So that wasn't fun. Besides that, I don't really.
Now you've been keeping up, obviously, you know that I'm always kind of harping on you about things, but you've been keeping up with the metagenics, the
Yes.
prenatals, and
Yes.
Okay.
So if you are pregnant and looking for a good prenatal vitamin metagenics, and it was actually in one of the previous videos, I think week 8 or week 9, he was talking about the metagenics vitamins that he has recommended for me. Those have been working excellent. I would definitely suggest those for anybody. Those are very, very good vitamins in general, but if you are pregnant, they have excellent prenatal vitamins.
perfect. So before we hop in and I start everything on the adjustment, I just wanted to say thank you to everyone out there who's been watching the videos. I've got the popular uploads pulled up. We've got 1.5 million views. We have another one at 500,000 and another one close to 500,000. Definitely just want to say thank you. I never imagined that my videos would reach this many people, and I'm so glad that it has been, and I'm always going to keep uploading videos, multiple videos a week. I love educating patients. I love showing my passion in what I do. So that said, let's go ahead and get this adjustment started.
All right.
I'm going to have you lay face down for me first. Okay. So her main thing that she was saying today, she was feeling the sciatic type pain more on that left side and going down into the glute here. So always when I go to start off a video, things that I like to look at, I do come all the way down here, and I like to look at the leg length. So in looking at the leg length, her right leg is a little bit shorter than the left. But one thing that I do notice, and if you come around this way, so when I scan the spine going up, as you can tell, everything is rocked off to that right side like that. So these are things that I'm looking at. So she's having pain more on the left side, but she's rocked literally to the right here. And then when we're looking up through here, these are the next areas where I'm looking at. So as you can tell, she's got a very good lordotic curve in that lumbar spine, and then also in the thoracic. So her curves are good. So let me show you guys. I haven't pulled my spine out in quite some time, but so this is what we're looking at here. So we've got our hips, we've got our sacrum, we got that nice curve in that lumbar spine just like this. And in the thoracic spine, it has what's called that kyphotic curve. And then going back into the cervical spine, you have that nice lordotic curve. So these are the 3 curves that we're always looking for in the spine. And you got to realize when you tend to lose a curve, what that's doing is it's putting excess pressure on these nerve roots. And you got to realize all those nerve roots are what go to your organ cells and tissues in the body. So when you have extra pressure on those nerves, your body isn't able to heal and function as it should. So as a chiropractor, what I do, we just take pressure off those nerves and we allow everything to heal and function. That's, exactly what our bodies were intended to do. So what I'm going to go through, I'm going to feel for symmetry on either side. We feel on the left side, we feel on the right side. I'm feeling for muscle tonicity, feeling for any taut, tender muscle fibers in here. On the spine itself, when there's what's called a subluxation, you can find areas where there's almost like a divot in the actual spine itself. So we go all the way up, we go entirely through the thoracic spine, and we're coming up to the cervical. Now I am also feeling quite a bit of tension right through here on either side. and a little tightness in the neck as well. So it's been, usually now we've been doing, you know, the weekly update. So she's normally been getting 1 adjustment a week. Usually a little bit further along in her pregnancy, we'll up that to 2 to 3 times a week just because of the change of what's going on with her body. So we want to keep up with that. So where I'm going to first start is we're going to start up at the neck here, and then we're going to make our way down. So we're going to start right up here at the T1, at that cervical thoracic junction right here, that CT junction. So we do a nice little distraction. We're going to do that T2 on the left here. Good. And we're going to do that T1 on the right. Good. Get some good movement. Now I like to work down from here. So we're going to come through this thoracic spine. If I can have you take a deep breath in. Exhale all the way out. Good. Let me felt that move.
Oh, yeah.
I'm going to do one more time with that deep breath in. Exhale all the way out. Good.
Wow.
Yeah, I can tell you. I know you felt that. All right, now we're getting into that.
Even you feeling it, this side feels so much more tender.
So when we look down and we're scanning your body, what's happening is your hip like this is turning to the right. So what's happening is your body is just muscle guarding, and it's automatically just unconsciously thinking, and it's protecting what's going on in here. So it's telling me, when I look at the biomechanics of your body, that there's some type of issue going on, and these are just like little cues that I always look for with all patients.
Can it be because I carry Angelo on my side?
It can, yes,
like
from carrying our son, yes. And a lot of times, especially women who carry a child on one side or the other, you got to realize they're using, like all their weight and all their strength on one side, and that can really start to almost put a scoliosis in women's spine. So what I'm first going to do, I'm going to have you turn on your side and face me.
Okay.
I'm going to have you bend that top knee, bottom one straight. Good. Lock those shoulders out.
Oh.
Good.
Wow.
I want you to turn to the other side here. Good. So here we want to lock those shoulders out. Good. Flat on your back for me.
Oh, a lot of movement.
Good. So from the supine position, leg length is looking balanced, looking good. So what that's telling me is that issue was in that lumbar spine. So when we did those side posture adjustments, that cleared it out. Because typically, I'll do that sacral adjustment with the drops, but today it's not showing that it's a sacral, it was that lumbar.
Okay.
So then always things that I do throughout the adjustment, I do the leg pull. What the leg pull is going to do, it's going to just help clear out if there's any issues going on in the ankle, the knees, and then even right at where that femur, at the hip joint. So I make sure her leg's very loose.
Dang.
And I know she felt that down here in the ankle because I felt that move. Same thing here. Both ankles I felt move. Good. So I'm going to have you come on up. So now when we go to do the neck, let's stand right. I'm going to have you stand up right here.
Okay.
And so now I do a standing cervical adjustment with her just because she's my wife. I've adjusted her numerous times. I know this is how her neck moves very well in this position. So usually when a chiropractor gets to learn a patient, understand their body a little bit, you'll know what adjustments are easier to do on patients than others. So with her, if you want to come on in here. Good. There we go. Yeah, I know you felt all that. And you guys at home probably heard that too. Yeah, she gets really good movement, especially in that standing position. Now, I've done supine, which means laying on your back. I've done adjustments like that. They don't want to move as well. I've done adjustments with you laying face down on your stomach, which means lying prone. Still don't move as well. So the standing position definitely does work. So what we're going to have you do next, I'm going to have you take a seat right here. And we're going to do the Y-axis distraction. So every week we just want to decompress that spine. We want to take pressure off the nerves all the way up in that upper cervical area, going all the way down the rest of her back. So I'm going to have you put this over. Pull your hair through for me. Good.
I actually have my hair up this time.
Yes, you do.
Makes it a little easier for you.
And lean back. There we go. Now I know with this one you probably felt that going all the way down. So I'll have you relax just for a minute. Got a lot of movement with that one.
Sure did.
How are you feeling?
Good.
Perfect, come on up. Alrighty. So is there anything that you'd like to tell to your, other mothers that are following, other expectant mothers? Any things to look out for, especially right around this time, because this is going to be your second child.
Correct. Yep. Well, what do you mean looking out for as far as what?
Any symptoms, any things that you felt, or even last pregnancy, any things that...
I mean, every pregnancy is different. Every pregnancy is going to be different. Every person is different. As I said with my last, it was awful. I was throwing up until, 5.5 months?
Mm-hmm.
Constantly, all day, every day. The only thing that was helping me was staying hydrated by getting saline, the IV therapy. Now, this pregnancy, I have not thrown up a single time. It's completely different. I mean, honestly, I would just recommend, just
staying active, eating well, the prenatal vitamins,
Exactly.
just your normal everyday.
Yep, get your adjustments, stay active.
Perfect.
Don't overdo anything. Don't be picking up anything too heavy.
Yes, and I always kind of...
I know. I always feel like Superwoman. I feel like I
Yes,
can always do everything, and I forget that I'm pregnant at times. I'm feeling so good with this one.
But, alright, so if there's anyone out there who is ever looking to schedule an appointment, a lot of times, and I get a lot of people that always send me emails and they say, are there any chiropractors in my area that do this? It's hard to say. There's so, just depending on where you're from. I know that here in Greenville, South Carolina, this is how I do adjustments on my patients, and I get great response. I've been getting people actually from all over the U.S. that have been flying in, and they come in for, get a full exam, full workup, adjustments, and they absolutely love it. So if anyone is looking for that, I'll have all the information listed below. I'm Dr. Cipriano over at Palmetto Physical Medicine out in Greenville. Have a good one, guys.